Over the last 20 years or so, doctors have increasingly prescribed opioids to help their patients manage pain. For many, these medicines have been the answer to their prayers, but for others, they have led to a nightmare of addiction.
Behind the numbers, you see the human impact of this epidemic. Families trying to find and afford treatment for a loved one hooked on painkillers. Children neglected or left behind by an addicted parent. Victims of crime fueled by addiction. Law enforcement, community officials overwhelmed by the flood of opioids and cheap heroin.
This is the most urgent public health and safety crisis facing my home state of New Hampshire. And having served as the Attorney General of our state, I can assure you I have never seen anything like this in terms of the epidemic that we are facing. I had the privilege of doing a ride-along with the Manchester Police Department, and I also did one with the Manchester Fire Department. One of the cases that I went to, there was a baby in a crib in the corner. And so when we think about this is not just the impact of those who are struggling with addiction, it's the impact on all of our quality of lives and, of course, on the future for our children.
Why are all 50 states on a bipartisan basis saying we need help? This is everybody that's having this problem. What changed was that we changed our attitudes in America and our practices in America in the late 1990s about how we deal with pain. Why aren't we talking about that? In 2010, we prescribed enough OxyContin in this country to keep every adult in America high for a month.
You know, we don't have to go to the border here to see the source of opioids. You go to the pain clinic in the mall. You go to the doctor, just around the corner. You go to the pharmacist who looks the other way. And clearly, I think we have a responsibility here. Pharma is making a fortune off this.
If we focus on, for example, the prescribed painkiller problem, then I think we're going to see an increased uptick in heroin abuse. I mean, it's obvious it's happened in North Carolina. It's a matter of state policy. We did a number of things to crack down on drug shopping and the sorts of things that we were seeing in the state. And there's almost a direct correlation between a reduction in those prescribed opioids and an increase in heroin abuse.
It isn't coincidence that our irrational exuberance around painkillers is matched by the rising heroin crisis. And so I am convinced that if we went back to the old policies on pain medicine, which is when someone has chronic pain, treat it, and treat it hard. But don't pass this stuff out as if it's not a problem.